Ya está, grabando. Ya.
Hello. Hello, Vanessa. How are you?
Hello, Steffi. How are you? I'm very well. Waiting for this pandemic to pass. Well, I'm a little overwhelmed by everything that is happening in the world. I feel very sad about this, but we have to pray and hope. We have to pray and hope.
Oh, what do you know about the coronavirus?
Well, I'm going to tell you everything I know about the coronavirus. First of all, coronaviruses are an extensive family of viruses that can cause disease in both animals and humans. In humans, several coronavirus are known to cause respiratory infections that can range from the common cold to more serious illnesses such as respiratory syndrome. COVID-19 is currently a pandemic that affects many countries around the world. The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Some patients may experience pain, nasal congestion, sore throat, or diarrhea. These symptoms are usually mild and appear gradually. A person can get COVID-19 from contact with someone who is infected with the virus. The disease is spread mainly from person to person through droplets that fly out of an infected person's nose or mouth by coughing, sneezing, or talking. Isolation is an important measure that people with symptoms of COVID-19 take to avoid infecting others in the community, including their families. In addition, people who don't have the disease, like you and me, we are also complying with social isolation to avoid being infected by other people. To date, there's no specific vaccine or antiviral against COVID-19. And, and tell me, Steffi, how serious is a pandemic disease?
A pandemic occurs when a new virus like COVID emerges, spreading around the world, and most people don't have immunity against it. The situation is serious because it can cause mortality of people if they don't take adequate measures to take care of themselves.
Yeah, I think
Um,
it's so important to take the measures, the sanitary measures.
yes, and Europe is known to have developed food and exercise tips to help people in quarantine. What do you know about that? What food and exercise is good in this moment, in this time?
Well, yes, I was reading about these recommendations, and I think they are super good. I'm going to tell you a little. In order to support individuals in eating healthy during self-quarantine and isolation, World Health Organization Europe has prepared a set of general tips, a list of best food buys, for example, and few examples of recipes for inspiration. On the other hand, for optimal health, it's also important to remain physically active. I'm going to tell you some of these food tips. First of all, make a food plan. Buy only what you need. Avoid over purchase. Be strategic about the use of ingredients. Prioritize fresh products. Prepare home-cooked nutritive meals. Be aware of portion size that you eat. Follow safe food handling practices. Limit your salt, sugar, and fat intake. And consume enough fiber. Stay hydrated and avoid alcohol, or at least reduce your alcohol consumption. And about exercise tips, well, World Health Organization recommends 150 minutes of moderate intensity or 75 minutes of vigorous intensity physical activity per week, or a combination of both. Uh, Take short active breaks during the day, follow our online exercise class, and walk, even in small spaces, walking around or walking on the spot, can help you remain active. Stand up, reduce your sedentary time by standing up whenever possible. And finally, relax. Meditation and deep breath can help you remain calm. And Steffi, uh, what do you think about it? What can governments do to prevent and slow down transmission?
Government can quarantine people to stay in their homes and avoid contagion, and also raise awareness of the importance of wearing face masks and gloves and disinfecting, and also share alternative medicines together with your medical team to establish their virus symptoms.
Yeah.
Benny, do you think scientists and virologists will find a cure for the coronavirus?
Well, I hope that scientists find the vaccine as soon as possible, but I know it's too soon to know when we might have a drug that can treat the coronavirus. However, we should start to get the results of trials in the next few months. This is much earlier than we will know if a vaccine is effective. This is because doctors are testing drugs that have already been developed and are known to be safe enough to use, whereas vaccines researchers are starting from scratch. Some completely new experimental coronavirus drugs are also being tested in the laboratory, but well, are not yet ready from human tests. Yeah. And Steffi, in your opinion, what are the main challenge that COVID-19 brings to our healthcare system?
In my opinion, the main change for doctor is to decrease the number of infections by applying the necessary medication that can keep patients stable. In addition to having more space when he hospital to care for the patients, since many are not served.
Yeah, I agree with you. And well, Steffi, hopefully the virus will pass as soon as possible. And let's take the sanitation measures. And well, let's respect a quarantine.
Yes, if we all should respect the protection and measure to get out of this situation.
Yeah. Well, Steffi, it was nice to see you. Take care and stay home. Bye bye.
Bye.
Y